Hi, does your back hurt when you squat or deadlift? Do you have shoulder pain when you're benching or pressing overhead? Have you already tried taking off time away from the gym, away from lifting, and you still have pain, or when you go back you have the same pain again? Then it's probably time for you to schedule an evaluation with a physical therapist. So taking time off after you have a chronic injury, or if you're having a chronic injury like back pain when you're squatting or deadlifting, doesn't mean you should just take away time from the gym, because all you're going to do then is get weaker, you're going to not improve your technique, and when you go back, that's when you're going to keep having pain. The way to fix that then is to work on finding ways to reduce the pain, work on strengthening muscle imbalances, and then progressively going back to what you were doing the correct way, safely and pain-free. So one of the things I normally see in people who are having back pain when they're squatting and deadlifting is they usually have too much pain, or they have improper spinal alignment when they set up with the lift or throughout the movement itself. So a lot of times when I see someone who's deadlifting, for instance, they're starting out either too hunched forward from the bottom, or they might start out even right, and then as they go to pull up, now it's bent over. Or even people who excessively extend and come up. Again, the spine is moving too much through that movement. We need to find the right way to keep it stable as you're going. A lot of times that's just because the person isn't coordinated, they might not be flexible with the hips, knees, or ankles, or they might not have the proper hip to core strength that you need for the movement. So what we would begin with then, if you're having pain, if you have a bulging disc and you're deadlifting, is start working on the right ways for you to move, looking at what you are having difficulty with. So for instance, a lot of time when I'm seeing someone working on, they're bending too far forward, we're going to start out actually just working on hinging at the hips at the wall. So keeping your back straight, finding the wall behind you, and just working on this. Again, it's not a lot of motion, but then you're going to progressively get back to then being able to deadlift. And we'll start out with something very light where you're hinging at the hips, keeping the back straight, coming up and down. So if you are having pain with any lifts, if it's benching or squatting or deadlifting or any other lift, make sure to schedule an appointment here at Loudoun Sports Therapy Center in Sterling, Virginia.